But Ted, I'm going to ask you for your closing thoughts in a second. But I do want to thank you for coming on the show. My guest has been Dr. Ted Epperly. And one of my family medicine mentors through the years. And we're talking about his book, Fractured, America's Broken Healthcare System and What We Must Do to Heal It. And check out his the website for the book at fracturedhealthcare.com. And you can check him out at Amazon and Barnes & Noble. And my final question for you, Ted, is that when people listen to this program and when people read your book, a lot of our colleagues, our physician colleagues, and also patients or citizens of the nation here can be very inspired to do something, to try to change our healthcare system. After they read your book and after they get some ideas in their head, what advice do you have for action steps for not only our physician colleagues but for the public in general?
Yeah, boy, that's a great question. For the public in general, Mike, a couple things. If we can all take greater accountability towards our own personal individual health, that's something under our control, we'll be part of a healthier nation, and for that we'll be a better nation. Also, if we can do that then as an accountable patient or family member for others in our family, and by the way, I have a whole section on the importance of mothers and the importance of women in healthcare decisions in our country. They are a valuable asset to helping us have a healthier nation. But if we can then be accountable at a family level in terms of trying to help our other family members be healthier, that's what I would say the general public could do. For the physicians that are on the line or part of the podcast and you're following, Mike, I would say that the big thing for them is to recognize the value of the relationship they have with their patients. That is priceless. And to start to help work with them in proactive ways towards keeping them healthier. And I recognize right now many physicians are just caught up on this treadmill that I've talked about earlier with you. But there's a lot of movement happening out here in this space towards the patient-centered medical home about aligning payment. And for them first not to give up, not to burn out, not to just say the heck with it. They've got to be part of the solution, and they need to help transform their practices towards a better health care system, about a better patient-centered, health-facing enterprise that they're engaged with. And what I'd like them to do is be re-energized, quite frankly, about what it is we're trying to create, and to help inspire those medical students and others coming up through the pipeline to be the type of physicians that will help make that happen. For, if you will, the larger political entities in our country, I would like that all of them would read this and all of them could get on board with trying to work together in some degree of harmony around what it is we're trying to accomplish in our country. And that is a higher quality, lower cost, and more accessible healthcare system. And if we can together do that, I have no doubts that America downstream will have a much stronger healthcare system, one that can be role modeled to other countries in the world. You know, it's not a lack of our ability to do these things. It's a lack of our will to do these things. And I remain hopeful at all those levels I talked about, we'll get to a better healthcare system.
I can't think of a better way to end. My guest has been Dr. Ted Epperly. Check out his book, Fractured, America's Broken Healthcare System and What We Must Do to Heal It. Ted, thank you so much for the time. Best of luck with the book, and it's always great talking with you, sir.
Mike, thank you. I'm honored, and again, to all of you out there, thank you for being interested in this, and again, let's not give up on trying to get to a better place for our nation, and for that, we will be a healthier nation. And thanks again, Mike.
Thank you, Ted. All right, ladies and gentlemen, that ends the show here today. These type of conversations we definitely need in this country, and don't be afraid by the complexity of it, by the emotion of it, by the people trying to politicize it. This is something that has to be done. We didn't even touch on, but it has been talked about in the press. This is the path that we're on is unsustainable. and we have to change the path that we're on. It's going to be painful. It's going to be a lot of yelling and screaming and things, but this is something that needs to be done. And I appreciate Ted coming on the show. I encourage everybody to check his book out. If you don't know anything about our healthcare system here in the United States, if you think you know something, read his book. It will enlighten you to things that you may not know about as far as the complexity of our broken healthcare system and the complexity on trying to fix it. So check out the website for the book at fracturedhealthcare.com. You can go to Amazon. You can get it on your Kindle. You can go to Barnes & Noble. And also, I want to give a big plug to the Patient Centered Primary Care Collaborative. You can Google that, and that is another step that you can take to learn more information about this, and especially for my physician colleagues out there. TransferMed also is a great website out there as well. And of course, the American Academy of Family Physicians has a lot of good resources out there as well. But that ends our show. We went a little bit long today, but I thank everybody for hanging with me, whether you're live or you're listening later on the podcast. My name is Mike Savella. Check out my digital library of stuff at FamilyMedicineRocks.com, and shout out to everybody on Twitter and Facebook. We'll be talking about this more here on the show. So everybody have a good week, a good weekend, and we will see you all down the road sometime. Have a good day, everybody.